In the episode of the Huberman Lab podcast titled Dr. Natalie Crawford, Female Hormone Health, Fertility and Vitality, the host, Andrew Huberman, PhD, interviews Dr. Natalie Crawford, an obstetrician-gynecologist who specializes in reproductive endocrinology and infertility. The episode provides a science-based information on female reproductive health that can help women make informed choices about their fertility and health. Key ideas are that lifestyle choices matter for fertility, egg freezing does not harm future fertility, and menopause onset can potentially be delayed with a healthy lifestyle. Natalie Crawford, MD, provides a masterclass on female hormones and fertility. The most important key takeaways in the 3 hours and 27 minutes interview include: 1. Female fetuses possess the greatest number of eggs around the 20th week of gestation, but more than half are lost before birth. The onset of puberty prompts the release of eggs from the ovarian vault. 2. Girls undergoing early puberty might experience a reduction in adult height due to the premature closure of growth plates. 3. Extracting eggs for IVF or freezing doesn't diminish the overall quantity or future fertility. Instead, the focus is on accessing and safeguarding existing eggs. 4. Exposure to substances like evening primrose oil or lavender oil can lead to early secondary sex characteristics, although it doesn't initiate puberty. 5. Fetal susceptibility to reproductive issues is influenced by the mother's exposure during pregnancy, particularly exposure to chemicals in the 80s and 90s, which indicate potential negative impacts. 6. Regular exposure to chemicals or toxins is unavoidable, but opting for unscented products, especially for children, is crucial to minimize lifetime exposure. 7. Choices such as laundry detergent, shampoo, and soaps can impact toxin exposure. Using products with fewer chemicals is recommended. 8. The debate between cloth and non-cloth diapers isn't necessarily about permeability, but personal preference. Attention to toxins in diaper materials is crucial. 9. Breastfeeding for the initial 6 months contributes to immune system development. Although it doesn't guarantee fertility, it correlates with protection against certain diseases. 10. Menstrual cycle duration varies. It begins with the first day of bleeding. The luteal phase remains relatively fixed at 12 to 14 days, and regular cycles should be less than 35 days apart. 11. Irregular menstrual cycles, particularly with decreasing length, may indicate changes in ovarian reserve, prompting concerns about potential fertility issues. 12. Combined oral contraception or pill doesn't alter the release of eggs from the ovarian vault. It suppresses ovulation without affecting the total number of eggs. 13. Prolonged use of birth control pills may temporarily suppress anti-Müllerian hormone or AMH levels, impacting ovarian reserve assessment. Discontinuing use can reverse this effect. 14. Testosterone supplementation in males halts testosterone and sperm production, unlike estrogen-based birth control in females, as spermatogenesis is a continuous process. 15. Testosterone and sperm production are interconnected. Prolonged testosterone use may impact sperm production, with 25% potentially not recovering. 16. Irregular menstrual cycles may increase the chance of pregnancy during menstruation. Fertility varies, and tracking ovulation helps optimize conception. 17. The most fertile time is the 5-day window ending on the day of ovulation. Regular cycles help predict ovulation for optimal conception. 18. Higher estrogen levels increase libido, synchronizing with ovulation. Estrogen triggers luteinizing hormone or LH surge, enhancing the chances of conception. 19. Some women can feel ovulation. It's known as Mittelschmerz, a crampy pain indicating the release of the egg. 20. Daily intercourse increases fertility, especially during the fertile window. Every other day intercourse reduces stress without compromising success. 21. Nicotine, cannabis, and alcohol can impact egg and sperm quality. Moderation is crucial for those planning to conceive. 22. Pregnancy is not health neutral. One must be in good health to prevent complications. 23. Progesterone-based IUDs thin the uterine lining, potentially causing absence of periods after removal. 24. The Depo-Provera shot prevents ovulation for 3 months, but can affect periods for up to 18 months after discontinuation. 25. Oral contraception may impact women's perception of facial attractiveness in men, according to a study. 26. Birth control pills have potential risks and benefits. They may impact vaginal health and clotting factors. 27. Birth control pills can be beneficial for mental health, heavy periods, anemia, and conditions like PCOS. 28. Polycystic ovary syndrome, or PCOS, increases the risk of endometrial cancer due to lack of ovulation. Birth control pills can prevent this risk. 29. Birth control pills may decrease the risk of ovarian cancer, but could potentially increase the risk of breast cancer in some cases. 30. Factor V. Leiden mutation can be exacerbated by oral contraception, potentially leading to blood clots. 31. Screening for Factor V Leiden is not a routine recommendation before prescribing birth control, but individuals with a family history of clotting issues should consider it. 32. Screening for ovarian reserve, specifically anti-Müllerian hormone or AMH levels, is not routinely recommended by American College of Obstetricians and Gynecologists or ICSI, but individuals can advocate for it. The cost is approximately $79. 33. The number of eggs coming out of the vault is an indirect measure of the eggs inside, with a decline indicating a decrease in egg quantity. 34. Antral follicle count, or AFC, is an ultrasound-based measurement of eggs outside the vault. The expected range is 16 to 20 total follicles per month for a 30-year-old, decreasing with age. 35. Follicle count drops significantly around age 37, leading to a severe decline after 37. Egg freezing becomes crucial for preserving fertility. 36. Collecting eggs doesn't change what's in the vault. It provides an opportunity for potential pregnancies. Egg freezing success is influenced by factors like age, egg quality, and embryo development. 37. Egg quality decreases with age, leading to a higher risk of genetic abnormalities and miscarriages. Embryo freezing has higher survival rates than freezing eggs, but is more expensive. 38. Fertility counseling involves informed consent on the likelihood of success based on age, egg count, and potential embryo formation. Age 37 is a critical point for considering fertility interventions. 39. The optimal time for egg freezing is around ages 32 to 33. The procedure involves hormone injections for egg stimulation, with potential variations in protocols. The decision should consider the future sperm source, health risks, and pain levels. 40. Implanting one embryo at a time is standard in IVF, reducing the risk of monozygotic twinning. Success rates vary based on factors like age and embryo health, emphasizing the importance of multiple cycles for better chances. 41. The outer surface of embryos touched during in vitro fertilization or IVF may increase the chance of splitting, leading to a higher chance of monozygotic twins. 42. Embryo quality is a crucial aspect of fertility, and the cost of egg freezing in IVF makes it important not to waste embryos in the same uterine environment. 43. Cumulative success rates for pregnancy increase with the number of euploid, genetically normal embryo transfers, with 95% success after 3 transfers. 44. Embryo freezing provides benefits, especially for partnered individuals, as it allows for better family planning and intervention based on the number and quality of embryos. 45. Freezing sperm is recommended for men considering a vasectomy as a precautionary measure, providing flexibility in case of changing life circumstances. 46. Getting a vasectomy without freezing sperm first may limit options for future family planning, and sperm freezing is a relatively easy and cost-effective procedure. 47. Egg freezing and IVF involve a combination of hormonal medications, including follicle, stimulating hormone or FSH and luteinizing hormone or LH, to stimulate follicle growth, followed by a trigger shot to allow final egg maturation. Please give this video a thumbs up so that we can spread this information to others who share our same interests or circumstances. Be a helper. There you have it. Take care of yourself and your health. Please subscribe to my channel Culinary Physics if you haven't subscribed yet, and let's grow together as a community. Thanks for watching to the end, and I'll see you in the next video.